opened Rouen-Y in 2008. And that is a group of people, also the post-gastric bypass or bariatric surgery group, that has a startlingly high rate of SIBO. And, with the Roux-en-Y, for example, they literally chop out the first part of the small intestine, called the duodenum. They chop it out and they bypass it entirely. And they're changing the size of the stomach. And in my mom's case, she had her gallbladder removed at the same time. And that, you want to talk about a major abdominal surgery. Um, the gastric bypass, particularly
Yeah.
the Roux-en-Y, is huge. And I don't know if SIBO is so highly associated with that group because of the scar tissue, or because they changed the size and the digestive capacity of the stomach, or because they bypass the duodenum, which is
What?
huge.
Yeah.
And like that's where like the MMC waves, which we'll talk about in future podcast episodes, like 70% of them start in the stomach and then progress through the intestines, through the duodenum, and then the rest of them pretty much, I think the other 30% begin in the duodenum. And it's bananas that they just chop that out and bypass it altogether, and then they leave it dangling there flapping in the wind. And so I don't know, these people also tend to have a lot of nutritional deficiencies because of the malabsorptive procedure. So I don't know what, quadfecta situations happens, but that's another abdominal surgery that, whether it be from adhesions, the malabsorption, the size of the stomach, the digestive capacity, whatever it is, those people have a lot of SIBO across the board. So that's
Yeah.
another area where this could overlap with the current conversation.
Yeah. No, I think that stomach surgeries in general are fascinating to me. I know there's actually a surgery, or at least there was, where they like clip the vagus nerve. Are you
Mm-hmm.
familiar with
Yeah,
that?
vagotomy. Yeah.
That just blows my mind. But um but no, you're totally right. I think that like I I'd imagine the issues with gastric surgeries just from a digestive stomach, just from
Yeah.
a stomach acid standpoint, not even the
Yeah, if nothing else.
yeah, it's wild.
Yeah.
I will say another sort of root causal factor that I have been really heavily keeping my eye on, and I've been doing a lot of work with, is like liver bile flow issues.
Mm.
Um, I mean, there's definitely links with in the research with liver, like more liver disease, so severe liver issues in SIBO.
Mm.
But I do tend to think like, I mean, a lot of people with SIBO, if they're having like die off reactions, like that's always like a bing, 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 like a red flag for me when they come to see me and they're like, man, I just like haven't been able to tolerate herbals. Maybe their liver enzymes are a little elevated in their
Mm.
labs. Sometimes their bilirubin's a little bit elevated, which can
Mm.
sometimes be associated with poor bile flow.
Mm.
But I do think it's an issue, especially in methane cases,
Mm.
just because bile tends to help with constipation, bile
Mm.
flow. It helps to
Yep.
stimulate motility. It
Mm.
also tends to feed hydrogen sulfide
Mm.
bacteria, so it can balance. It can basically compete with your methane producers.
Mm.
But I do think that bile in general could be antimicrobial as well. It helps
Yeah.
control the pH in the environment in the small intestines. So if you don't have that mechanism running really efficiently, I've seen that be huge for certain people. And I don't really think it's talked about much in the SIBO
Mm.
space,
Yeah.
but I will say I've seen a lot of people respond really well. One case in particular that I'm thinking of was a woman who was maybe about 35, had been working on SIBO for a while, but she had real like severe pains that would creep up.
Mm.
And she kept getting her gallbladder looked at, and she was basically diagnosed. I forget what the phrase is, but it's basically like they think there's a gallbladder issue, but there's no mechanism that they can see.
Gallbladder sludge? Did they see sludge on the ultrasound?
No, I don't think they saw
No.
anything.
Okay.
But gallbladder sludge again to me would be an indicator that bile flow is not great.
Yeah.
But I do think bile, in her case, we really worked on the liver. We worked on getting bile flowing optimally, and she stopped having these really severe attacks. But just from what I've seen, again, working with people, I just think it's a really big area. The liver also takes a huge, has a huge burden when there's gut issues in general.
Yeah.
So I find that the liver is often very depleted in SIBO, just from
Mm-hmm.
maybe years of dealing with excess toxins.
Yeah.
And the liver is producing the bile and sending it to the gallbladder, and then the gallbladder spits it out into the small intestines. But if your liver
Mm-hmm.
isn't healthy, you're going to have poor bile production. And then you really want the gallbladder to be able to deliver the bile. And then if you've had your gallbladder removed, that kind of creates other issues. But you could still
Yeah.
have poor bile flow in that case from the
Mm-hmm.
liver not producing it if you had your gallbladder removed.
Yeah.
But I'm not sure if that's something you tend to see often, but it is like one that more recently I've heavily focused on because I've seen it be really helpful.
Yeah. Yeah. And I think to your point, the bile is antimicrobial.
Mm-hmm.
It helps set the pH of the small bowel. Not to mention, like, you need bile to just digest your food and your fat, and fat malabsorption is not uncommon with the SIBO folk and the IBS folk. But another thing that I'll kind of piggyback off of, which is interesting, I was reading an article not that long ago. I was making a presentation for my online course, and one of the things that came up was this idea of like what things need to happen to start the MMC waves, those clearing,
Mm-hmm.
cleansing waves in the small intestine. And most of the research we've got focuses on motilin. It's like, all right, it's motilin. We have to get motilin going. That's the answer. But then some people are trying to figure out, all right, but what triggers motilin release? And one of the things that I was reading about is that it might be the gallbladder emptying
Mm-hmm.
in a fasted state. If the
For
gallbladder
sure.
empties, that seems to precede and possibly stimulate motilin release. And then that gets the MMC going, and then boom, you're going to get rid of your SIBO because you have a proper functioning MMC wave or waves plural. So I think even away from mealtime, the potential for this to have broad reaching healing capacity for SIBO is really pretty profound. Um, so I
Yeah.
think to that point, and with the gallbladder removal people, gosh, it's so tough. Like I don't know about you, but I put all of them on ox bile
Yeah.
straight out the
Mm-hmm.
gates. And I tell them, when they ask me, how long do I stay on this? Until you sprout a new gallbladder.
Yeah.
That's the thing. Like, I mean, herbal medicine is wonderful and supplements are wonderful, but we're trying to combat effed up anatomy now. Like,
Yeah.
you're missing an organ. So this is a forever thing for you
You
unless
mean
you
the
sprout a new
gall
one.
you mean the gallbladder is important and it can't
Right?
be removed? Um well,
Conventional medicine, I tell you.
yeah, and I think it's interesting too what you're saying about um bile being a factor in the MMC waves because it is an ingredient in a lot of the prokinetics. Like artichoke
Mm-hmm.
leaf extract is
Mm-hmm.
mainly something that's going to stimulate bile
Yeah.
flow.
Yep.
I've seen in a couple different herbal prokinetic
Yeah.
formulas.
Quite a few.
So again, I think bile's like a really fascinating area that again doesn't I don't see getting tons of attention in the SIBO space. Maybe I'm not looking in the right places, but
I feel like you're right because honestly, I follow a lot of like SIBO experts and gut health gurus
yeah.
on the internets. And I think the only person who's ever done a post about it is you, honestly, because I've been following your stuff for years, and I think that you're the only one who's really done a post about it directly that I can think of off the top of my head. And I follow quite a lot of people, so I don't think you're incorrect. I think that you're the only person really talking about it, to the best of my knowledge. So go you first off,
Okay,
because
yeah, yeah, yeah.
I think it
Well,
is relevant and important.
yeah, no, for sure. And again, I've definitely seen people have improved motility, have if improvements in symptoms just by focusing in on their bile flow.
Mm-hmm.
So again, definitely something I see a lot of, and I think one of the more common ones that I'm going to throw out as a root cause is hypothyroidism.
Yes, that was actually going to be my next one I was going to bring up if you hadn't. So, yeah.
Yeah,
And that, I mean, this is another whole rabbit hole we could go down.
yeah.
But if nothing else, a beautiful segue is hypothyroidism is associated with higher frequency of gallbladder stones and gallbladder dysfunction.
Yeah.
So, is it that hypothyroidism mucks up your motility and mucks up your gut lining and mucks up your brain and your vagus nerve and the gallbladder? Like, what? Pick your mechanism. The thyroid
Yeah,
interacts with literally every cell of your body, so all hats are off if the thyroid is involved.
for sure. And it's so interesting to me in the thyroid space because so many people in the SIBO arena are doing things that are going to hinder their thyroid when they're working on their SIBO. So oftentimes, even if it's not like Hashimoto's, but I'll see
Mm-hmm.
lower T3 levels,
Mm-hmm.
and usually even just manipulating the diet, whether it's increasing carbs or overall calories, but in the SIBO space, carbs are demonized a lot,
Yes.
and you need a certain level of carbs to produce an insulin response, and insulin's what's gonna raise your active thyroid hormones. So oftentimes, even just manipulating carb levels or even calorie levels, I see being super helpful for thyroid issues that aren't like Hashimoto's, that are more just
Mm-hmm.
like suboptimal in
Yeah.
nature. But
Yeah.
I would say on like 80% of the labs that I see, people have suboptimal thyroid levels. It might
Mm.
not be like below reference range, but I certainly see
Yeah.
those. But, you know, gut function's not going to necessarily be great if thyroid levels are suboptimal.
Yeah. Yeah. And you're making me think of one patient I'm working with right now. And, we've made some headway together and we're making forward progress, but we keep kind of getting stuck. And I was like, look, we've taught her T3, the active form of thyroid hormone for the listeners at home.
Mm-hmm.
Her T3 is low enough that LabCorp is flagging her as low.
Mm-hmm.
Your
That's
T3 is in the
bad.
toilet.
Yep.
It's bad if because LabCorp's reference range goes down to like 71. So I think that hers, was like 68 or something. And I'm usually raising an eyebrow and squawking about it when it's below like 100 or 110.
Yeah.
So, from a functional perspective, this is in the freaking toilet. But
Yeah.
even from a medical perspective, it's low. And the thing that we talked about in our last appointment was, girl, we've got to get you on some T3. Like we've tried some of the tricks I have up my sleeve,
Yeah.
and we're at a point now where I'm like, I don't know if it's going to be a forever thing. I feel like it's not, but it's like we need to break this vicious cycle where right now your gut's not working and you're inflamed, so you're not converting T4 into T3 and you don't have any T3, but also the low T3 is messing with your motility and your gut lining and your brain and whoever knows what else and her hair because she's got hair loss. And it's like we've got to get ahead of this enough to break the cycle and get you some freaking T3 so that
Yeah.
you can heal your dang body. And that was literally like the bulk of our appointment. This most recent appointment was, let's get you to a different endocrinologist because the first one just was like, no, we don't. If you don't need Synthroid, you don't need nothing.
Yeah.
And and that was like the end of the story. So we're like, if your primary care isn't going to prescribe it, we need to pursue an endocrinologist who knows what they're doing and get you on some Cytomel or something that is a T3 product and see if we can at least get ahead of this for a month or two to facilitate the healing. And then we can talk about getting you off of the T3. But my God, you need T3 to heal stuff, and it's just not budging yet.
Yeah. Yeah, it always makes me nervous when I see people that have, pretty severe drops in T3 levels.
Mm-hmm.
Usually I would say like the people that I would say most of the time they're not necessarily below reference range, but they're certainly suboptimal. But whenever you are dipping towards like low end of what I'd consider optimal, or out of reference range, like you're certainly going to have symptoms. I know in my particular case, I was low T3
Mm.
through like 4 lab cycles. Um, but I was kind of a problem child because I went on T3 and I had like crazy blood sugar swings, um,
Mm.
like bizarre. And so we thought I was having a reaction to the T3
Mm.
in some weird way. Who knows what was going on? I was like
Huh.
a hot mess of different things at that particular time. But I will say for me, and I'm thinking of a recent client too, who when I manipulated my diet and this was a guy, when he manipulated his diet, he had been low carb for a really long time.
Yeah.
And, his
They're
T3
evil, so obviously.
exactly. His T3 levels were in the toilet, and we had just started working together, and he had just had labs done, and he was like kind of starting to intro carbs again, and there was already a huge jump in
Mm.
his thyroid hormones, and it's kind of
Yeah.
amazing. There can be micronutrient issues too, things like iron, um,
Yeah.
iodine,
Yeah.
selenium. Those,
Selenium. Yeah.
yeah, zinc is another one. But I think
Mm-hmm.
like definitely if thyroid's off, you need to come up with some plan, whether it's supplementing with certain things that might help or actually taking meds just to even to get over a hump,
Yeah.
I think
And
can be
that
really helpful.
and that's something I hear commonly is like people don't want to take medication. And
Yeah.
like I get it. I totally do. Like we're recording this still during the pandemic in 2020. It's like if nothing else, if the world goes weird and you don't want to leave your house for a while, like I get that you don't want to have a prescription. Uh, but if it facilitates healing, I'm hippy dippy crunchy, but I'm not so crunchy that I'm gonna cut my nose off to spite my face and not recommend something if I think it's needed. So it's like use the medication for a short period of time. We will have the goal to get you off of it, and then we'll worry about that down the road. But if we need to facilitate healing, let's just do what we need to do. And I will bring us to possibly our last SIBO root cause to talk about. Um, you had mentioned briefly with the thyroid whether or not it's Hashimoto's. And I do think that that's relevant. And I'll share with you this. I had to find this on my Facebook page because I had shared it a few years ago. But there was a study that came out, it looks like it was middle of the year 2017. Um, and here's a quote. They had looked at well, honestly, I don't remember now. It I believe they were looking at the relationship with levo and SIBO. And one of the quotes I pulled from it for my Facebook post was, one might speculate that hypothyroidism leads to hypomotility. But surprisingly, levothyroxine therapy was even more associated with SIBO and not able to reverse the effect of hypothyroidism. So they were looking and they were like, all right, if you're currently hypothyroid, is that associated with SIBO?
Yeah.
Yes. If you were hypothyroid, but now you're on levo and your levels are normal, is that also associated with SIBO? Yes, even more so than being currently hypothyroid. And I saw some people in, the hippy dippy functional medicine space, and I could see the writing on the wall. And this is why I did this post, because people already were like, oh, levothyroxine is associated with SIBO. This is terrible. Don't go on levo. And it's like, whoa, 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 whoa. Let's wait a minute. What that tells me is, and again, I'm going to use my mom because she has Hashimoto's and she's been on levothyroxine since the dawn of time, it feels like, since I was a
Yeah.
baby. And autoimmunity starts, and you've got some autoimmunity, but you still have the intact tissue. And it's able, like in this example, the thyroid is still able to make a normal amount of hormone. That's stage one. Stage number two, you still have the squirrely autoimmune attack because we're progressing. It's stage two. You haven't treated it yet. You still have the autoimmunity, but now the gland is disrupted or compromised to a point where you're going to be hypothyroid. Okay. But it's like early stage. Maybe nobody's done your yearly physical yet. They haven't ordered blood work. So you're hypothyroid. You surely have some symptoms by this point, but you haven't begun the medication. The people who are already on levothyroxine, are so much more progressed down the road of possibly, the
Yeah,
90% chance that these people have Hashimoto's. If
for
I was a betting
sure.
woman, I would take the 90% odds.
Yeah,
But 90% of these people on levothyroxine, or probably even more, have Hashimoto's as a root cause. And these are the cases who are not like the freshly diagnosed Hashimoto's people, probably. These are the people where the autoimmunity has progressed to a point where now they need replacement for that hormone
yeah,
because the tissue is that compromised. So to me, it's like, okay, the people who are newly diagnosed with autoimmunity or newly diagnosed with hypothyroidism, if they are autoimmune, it's earlier in the progression. So I can see why it's associated with SIBO. The people who are already on levo, it's like we're observing the same cohort of people, but just X amount of years in the future. So, of course, the people on levothyroxine have an even higher incidence of SIBO. And I think it's not that levothyroxine is bad or ineffective or that levothyroxine causes SIBO. Rather, it's that autoimmunity, if left unchecked, is going to compromise stuff. And among the stuff,
yeah,
I mean, the gut lining, your stomach acid, your motility, your vagus nerve, whatever. Like, but autoimmunity and that inflammation that ensues is not good for the things that you need to prevent SIBO, and therefore you're going to be much more likely to develop SIBO from what is most likely autoimmunity and not actually the levothyroxine. So that was my takeaway. So I consider autoimmunity to be a root cause of SIBO.
yeah,
And then ironically, SIBO can be a root cause of autoimmunity. So then it's a matter of like the chicken or the egg, depending on
yeah,
your health history and what makes the most sense. But I have seen those cases where, something else seemed to start the autoimmunity. And then after that was when the SIBO really started to creep up. And then we're trying to make sense of it down the road. So I do think that managing the immune system and the inflammation and balancing that out is not only helpful for the people with anti-vinculin autoimmunity, but also autoimmunity more broadly, because you may actually have to treat the immune system in order to heal the SIBO. It is a two-way street. For all that we talk about manipulating the immune system via the gut, you could also manipulate the gut via the immune system. And I do think
yeah.
that that's overlooked. And again, to the best of my knowledge, I don't think anybody's really talking about that two-way street and how the immune system and the autoimmunity directly affects the gut. It's almost always the other way around when I read about it.
Yeah, no, that's such a great point. And I do think, like, along those lines, too, um, I think that the autoimmunity component is huge, even for things like Crohn's, celiac. I mean, all those things are
Yeah.
highly associated with SIBO as well,
Yep.
just because there's inflammation and you probably get the same nerve type damage that you do in the anti-vinculin arena, the kind of autoimmune SIBO. You get that
Mm-hmm.
same sort of damage to the lining. Um, so yeah, I think again what you're saying too about manipulating the immune system to help with the inflammation and gut function is really interesting, and I think a great point. Um, so yeah, I'm in total agreement there.
Yeah. Yep. So let's think. To recap, we talked about.
I did want to ask
Oh,
one thing too, because
yeah.
I think like a lot of times in the SIBO space too, just as like an aside, um, I think that we talked about like dysbiosis and what that means in an earlier episode.
Mm-hmm.
But I do think that like a lot of times with SIBO, some of the issues could be because there's low bifido. I mean that affects the
Mm-hmm.
migrating motor complex. So I
Yeah.
do think that like it's there also could be a root causal factor of what's the overall ecology of your gut.
Yeah.
Um, and I did just want to mention that because even things like pathogens, like if you have a pathogen that you haven't treated, or just the overall ecology of the gut's not great, I think it's going to affect the immune system. It's going to affect inflammation levels. It's going to affect the migrating motor complex. It's going to affect a lot of
Yeah.
areas that are really key to dealing with SIBO. That's why clearing's great, but you want to make sure you repair and rebuild the microbiome as a
Yeah.
whole to really help control the environment, and create like a less inflamed environment.
Yeah, and I think that that dovetails back to your original point of antibiotics
Yeah,
potentially being a root
for
cause of
sure.
SIBO, because whether the antibiotics, for example, are disrupting the ecosystem in the small intestine itself, or if they're interrupting or making dysbiotic the environment in the colon microbiota, and then that is impacting inflammation and the vagus nerve and the motility and the MMC. I think that's still something that we're getting better quality research on. But I definitely think it's there. I think that, and this is where it's hard because so many people have had numerous rounds of antibiotics.
Yeah.
Even if you haven't ever been diagnosed with SIBO, again, like 87 humans worth of antibiotics in my lifetime. I don't know about you. And it's profound to think about what that does to the human body. I mean, the only people I've ever met who have had zero antibiotics in their entire life are the weirdos that I went to chiropractic school with. And I love
Yeah.
them. But like the people I'm picturing, the kids who were second or third generation chiropractors
Yeah.
whose parents are like ultra crunchy and like they've been adjusted since the day they were born. And like I knew a handful of kids like that in chiropractic school and graduate school. And I don't even know how it came up, but that concept of somebody who's never had an antibiotic is so foreign to my brain
Yeah.
because that was such a staple of my childhood. I was like, you what? Like never? Never
Yeah.
ever? So, you know, it's very difficult to study that,
For
I think,
sure.
because
I totally agree. And I do think that like some antibiotics are going to be more destructive. It
yeah.
seems like to me than others.
Mm-hmm.
Some are just really strong.
Yeah.
Some people again like had an experience where they were on like IV antibiotics and
Mm-hmm.
like just really strong stuff. And I think that matters too. Uh, and sometimes again, like from my thinking and from what I've seen, it tends to be another straw. So like what you were
Yeah.
saying earlier about the triggers, it's not necessarily that like their gut was perfect before that. There was probably issues still there.
Yeah.
But it was an extra straw on to the already storm that was brewing.
Yeah.
And it's just, it is really unfortunate how like we pop antibiotics like candy, and I think antibiotics are really useful in certain situations. So
Oh, yeah.
I'm also not anti antibiotic either. We do need those in certain situations, but
It's like PPIs, in my
yeah,
opinion. They
exactly.
both have a place, but they need to be prescribed like, you know, it at the current prescribing rate, if we could cut down the prescriptions by 95% for
Yeah,
both of those, it's not that I want to take them completely off the market necessarily, but like reserve the PPIs for the really bad cases, like the fresh bleeding ulcers, the ones that are really raw, like
yeah,
save it for those people. And the people who have reflux or indigestion or whatever, like we need to have other tools in the toolbox to help them because that willy-nilly prescription writing for both. And like, I mean, and I've chalked up the antibiotics for years to, I laugh and I think about my mom and I'm like, I can imagine my mom being like a Karen, if you will, or a Carol. And like
yeah,
going into, I can picture the two of us going into my pediatrician in my mind's eye. And I have a very loving and slightly overprotective mother. And I love her. Hi, Mom. And I can picture, like, if I had the sniffles or if I had an ear infection, if we went into that pediatrician office and they did not write a prescription for me in that moment, ooh,
yeah. There'd be
oh,
hell to
Robin would
pay.
not have been happy. She would have lit into them, I'm
Oh
sure. I
my
mean, I don't remember
gosh.
this in childhood, but I'm sure she has the capability of being like, no, you write my baby a prescription right now.
Yeah,
She is suffering and we need to get rid of this infection. And, I think about these scenarios and I'm like, I, I feel sympathetic for the doctors who have written prescriptions, because I do think that sometimes like the really overprotective vocal parents played a role, and also like it just medical school, whatever it is. So I think, I have a teeny bit more understanding looking back at like the 80s and 90s why we were overprescribed antibiotics,
Yeah.
and like the helicopter parents and like the really intense parents. But then now it still boggles my mind, the overprescribing of antibiotics. And I was like, I thought we were done with that.
Yeah.
Like, we've been talking about the concept of antibiotic resistance. Oh my God, like, this is a big deal. Like,
Yeah.
don't over, like, we've been talking about this at least into the 2000s. So you would think that in 2020, prescribers would know not to use these. But I kid you not. I mean, I think it was last year in the winter, like winter 2019. I don't know if I told you this, I had like a cough that wouldn't go away. My daughter was new into preschool, and the preschool germs are crazy. And
Yeah.
my mom and my husband and I, we all had this cough, and mine didn't go away for like 2 months. And my mom, being an overprotective, loving mother, was like, you need to go to urgent care. You have a daughter to live for. She was basically implying that I'm going to die from this cough. And I was like, oh my God, what if I have pneumonia? Okay, mommy, I'll go.
Yeah.
So I went in and I told the nurse practitioner, just clear as day, eye to eye, we had a come to Jesus moment. And I was like, all right, look, I want to let you know, I'm here because my mom has convinced me I'm dying. And I want you to listen to my lungs and give me your medical opinion. If you think that I need antibiotics, I will take them. However, I have a history of IBS, and I have celiac disease, and I've got weird gut stuff, and I've had a lot of antibiotics in my life. I don't want antibiotics. My preference is to not take antibiotics. So you have to tell me, like, if you really think I need them, I will take them. But shy of that, like, if you don't think they're necessary, I don't want antibiotics, just like, so you know that. She's like, cool. She listened to my lungs in 2 places, which is another, like, the shoddiest physical exam I've ever had.
Yeah.
It's supposed to be 7 on each side. Like, I took physical exam, like, I remember this from my doctoral training, like, it's 7 on each side, 14 total. But she listened to 2 places, went, yep, okay, doxycycline. And I was, actually, I think she wanted to write me something else first, and I was like, I can't, I'm allergic to that. So she's like, okay, doxy. And I was like, whoa, okay. I was thinking, man, this is serious. And meanwhile, I asked her for 1 pill of diflucan to make sure I didn't get a vaginal yeast infection. You would have thought I asked her for crack cocaine.
Yeah.
She was like, well, I'm worried about your liver enzymes.
Yeah.
Why? I measure them every year. I'll tell you they're fine.
Yeah.
1 pill of diflucan? You really, what? She was going to give me the antibiotic with no problemo, but she had a heart-to-heart with me about the damn diflucan.
Yeah.
So then I go home, and I'm like, all right, I guess I need this. So I took 1 pill of the doxycycline, and then I looked at the handouts. Right at the top of the handouts that she threw at me on my way out the door. All about viral bronchitis. First line of the handout. Viral bronchitis is from a virus and will not respond to antibiotics, so don't take them because it's a viral thing. And I was like, oh, no. And that was my official diagnosis, was viral bronchitis.
My gosh.
And she gave me doxycycline. And I wanted to honestly punch her in the face, but I did not. Side note, I'm not actually violent. But like, I told her, we made eye contact and had a come to Jesus moment. And I told her point blank, I do not want antibiotics. I'm here for your medical opinion, but I'll take them if I'm like going to die. And she gave them to me anyway. And and then I listened to my own lungs because I have a stethoscope. And I was like, oh yeah, that sounds like bronchitis.
Yeah.
Oh, well, you live and you learn. So I still, to this day, I have the doxycycline in my cupboard because I'm tick paranoid. And if I get a tick and I think I have Lyme disease, I'm taking the doxycycline.
Yeah.
But it's just like, it's 2019. This is not 1986.
Yeah, when
my mom and I going into the pediatrician for an ear infection, and my mom giving them hell because they didn't prescribe her baby an antibiotic. Like, this is 2019, and you gave me an antibiotic just for shits and giggles. I'm going to calm down. I'm going to pass the mic to you. But
I think that one thing about
stuff
your story,
happens,
I think you had a come to Jesus moment, but I don't think she picked up on your come to Jesus moment.
right? I thought I made myself abundantly clear. And I think it's that honestly, I can't imagine what it's like to work in an urgent care.
Yeah.
I can't because I think that poor woman is probably so burned out and just like over medicine. Honestly, like every moment with her, I was like, "You're like burned out. You need a vacation for a lifetime.
Yeah.
Like you need a different job. You're not happy." But still, like, be competent, be or at least like use your ears and listen to your patient. She didn't use
Yeah.
her ears to listen to my lungs very much, but use your ears and listen to your patient when they tell you they don't want antibiotics. But it was just like it was so, knee jerk reflex, like, yeah, here, prescription, see it. What you want doxycycline or what you want diflucan. Oh my god. Like that made her perk up a little bit, the diflucan
Oh
request, but
gosh.
not the doxy. Take that like candy. It's like a Snickers. Just
Yeah.
take it.
Oh, man.
Anyway, so it is to say we're all doomed. We're not.
Superbugs.
Yeah, but I think we've covered SIBO root causes pretty in depth.
I do too.
Mucking with your stomach acid, mucking with the microbiome, thyroid, autoimmunity, the post-infectious model of it, adhesions and scar tissue. All of these are on the table. These are some of the most popular stress. Holy crap, I almost forgot that one. Stress and how that affects the human body. Gallbladder stuff. I think these are a few of my favorite things.
Yes,
And
exactly.
things I talk about all day. I'm sure you do too. But I think that's just about a wrap for today. And in the next one, we're going to talk more about that squirrely post-infectious IBS thing. And we're going to go into some of these root causes in more detail as time goes on and as we record more of this beautiful podcast together. So, Amy, thank you so much. I appreciate you so much. And people tuning in, if you are on YouTube, if you could like this video, comment down below, and subscribe and ring the bell, that will help us grow this channel and grow this lovely podcast and help more people. And if you are listening on iTunes, Spotify, any of those like podcasting doohickey apps that you have, if you could rate us 5 stars, that would be awesome. And that also helps us reach more people and just heal the world and heal everybody of their SIBO. So thank you so much. And thank you in advance for your kind reviews and likes and subscribes. And we will talk next time, Amy.
Yeah, sounds great. All right. Talk to you later.